So we have two more short presentations. Our next one is Dr. Aleksandra Maceski from CHU Montpellier in France, who will be talking about an application of detecting tau and amyloid beta in dried blood spots. Please welcome her.
Thank you. Thank you.
Microphone?
No, I have
Oh, the clicker?
the clicker.
It's right here.
It's hard. Good afternoon, everyone. Thank you very much, Julian, for this introduction. I'm research and development scientist at the Laboratory of Biochemistry and Clinical Proteomics at University Hospital in Montpellier, France. Our lab is a specialized center for Creutzfeldt-Jakob disease diagnosis, but involved also in biomarkers research and discovery program, especially blood biomarkers for neurodegenerative diseases such as Alzheimer, ALS, multiple sclerosis. We do evaluation of emerging technology, development of innovative approaches using mass spectrometry and immunoassay. But today I choose to present to you one of our recent projects, which concerning the detection of tau and amyloid beta in dried CSF spots. Before to go with the project, let me just briefly remind the hallmarks of Alzheimer's disease neuropathology, which are amyloid plaque formation and neurofibrillary tangles in the brain parenchyma, leading to the neuronal death and progressive memory impairment. The main molecular actor are amyloid peptides, which are aggregated in extracellular spares and are less represented in fluids, and tau proteins present intracellularly and are released after neuronal cell death in the fluids. So we observe decreased level of amyloid beta 142, increased concentration of tau and phosphorylated tau in CSF of Alzheimer's patients. And those biomarkers are actually the main biomarkers in Alzheimer's disease diagnosis. Early this morning, Charlotte already told you that Alzheimer's disease diagnosis is based on immunodetection of those biomarkers and in CSF, which is for now validated. And those biomarkers actually are measured in specialized clinical laboratories. And since those biomarkers are measured in specialized centers, there is a need for shipping samples to them in the best analytical condition in regards with time, quality, and cost. And this is especially true where samples are collected in other countries as Africa, Middle East, in large-scale studies, and so on. In our lab, we work a lot with alternative sampling methods. We use a lot the dried blood spot. Maybe some of you heard of that. It's a blood sampling method, alternative method, on a filter paper card, which it's like this filter paper card. The blood is spotted on this, and we came up with the idea to spot some CSF samples on those filter paper cards, just to evaluate the feasibility of measuring tau and amyloid beta biomarkers on those dried CSF spots, as we call the method. And we kind of get interested in this method because of its advantages, like stabilization of the analytes, more than 50 days, inactivation of pathogens, so the samples can be shipped by regular mail at low cost, and the facilities of storage. But the main limitation that we have with the small samples volumes is the sensitivity. So we need sensitive technology to measure them. And fortunately, we have similar technology in our lab, so we could establish a protocol how to measure the Alzheimer's disease biomarkers on those dried CSF spots. The samples can be prepared directly upon the lumbar puncture. 1 to 2 drops can be spotted per cycle onto the filter paper, or the samples can be prepared at laboratory once the CSF tubes arrive in laboratory. In this preliminary study, we prepared in lab our dried CSF samples for 30 patients with or without Alzheimer's diseases. The samples were dried for 2 hours and then stored at -80 until analysis. So the protein were extracted from one punch of 6 millimeters of diameter, which is really, really small punch. And we put this punch in elution buffer for 1 hour at room temperature. And tau, amyloid beta 40 and 42 were measured in supernatant of the dried CSF spot method, and in the corresponding CSF samples diluted 100 times using a multiplex assay with SIMOA technology. In the first place, we wanted to evaluate the analytical performances of this dried CSF spot method for detection of tau and amyloid beta. So we assessed the limit of detection, the limit of quantification. We found a very low variation within and between run. In 5 runs, the CVs was less than 10 and 50%, and moreover, and which is very important, the analytes were stable on the dried CSF spot method at up to 7 days when stored at 4 degrees or at room temperature. Then we compared also the results from the dried CSF spot method to the CSF samples, and we find a significant correlation for all 80 biomarkers already validated as tau, amyloid beta 42/40, but also we compared the ratio A beta 42/40 and tau beta 42 ratio, which are also known as very good biomarkers in ID diagnosis. Moreover, we found increased concentration of tau A beta 42 ratio in the Alzheimer group compared to the non-Alzheimer group. And we found decreased concentration of amyloid beta 42 and 42/40 ratio in Alzheimer group compared to non-Alzheimer group. Since those results are kind of correlation with Alzheimer diagnosis, we go for rock curve analysis of these dried CSF methods for all the Alzheimer diagnosis biomarkers for AD group versus non-AD group. And we find that this method has good accuracy, very good accuracy and performances, and especially the highest area under the curve were for the ratio A beta 42/40, tau and tau A beta 42 ratio. So, in conclusion, we could determine tau, amyloid beta proteins from the dried CSF spot method using SIMOA technology. This method shows very good accuracy and performances in Alzheimer biomarkers, and eventually could be used as alternative CSF sampling method for harmonization of pre-analytical condition, shipment and storage facilities. However, this is the preliminary results, needs to be done in a large cohort study, needs to be validated with more inclusion of healthy patients, AD and middle cognitive impairments. And on this, I would like to thank all the members of my team, led by Professor Lehmann. And thank you for your attention. Any questions?
Yes.
Yeah.
Congratulations on that.
Thank you.
It's actually a project I've thought of, so it's good that you've gone ahead of this, because with all this sensitivity improvement and biomarker driven medicine that we're talking about, we also have to think about the cost and then the settings that these things may not be easily accessible. So back to the talk, you talked about using, being able to ship by regular mail, which could have some issues there.
Okay.
So, because I mean, although you spot them onto filter paper or any other kind of paper, they get dry, but if there are any pathogens or anything out there, you could be exposing. So that might be something to think of. And also, if whilst you do the spotting, I mean, these are things that I would expect you to have done already, or think about that whilst you do the spotting, if you use the same volume, if you spot onto, maybe there should be a way of sort of normalizing whatever, like the size of the spot. Because if you have maybe a bigger size of filter paper, if that has an effect, and all these sort of things. But do you also have a plan that once you validate these, you could probably look at the cost-benefit analysis, and if it's possible to get, let's say, to transfer this technology to some of the centers that you're collaborating with in the developing countries?
Exactly. Thank you very much for these questions and this interest. Yes, exactly. As I say in the beginning, the advantages of the dried sample method are the fact that the pathogens are neutralized when you spot the samples, they get dried. So all the pathogens are kind of neutralized. This type of sampling method is worldwide used for HIV, in HIV screening, and it's well known that HIV is neutralized on those dried samples spot. So kind of when it's no risk of infectious risk of transmission of pathogen, of contagion with those samples, there is no problem to be shipped by regular mail. And there could be an issue with shipping samples by regular mail, exactly because of delay of delivery of the samples and so on. But that could be harmonized. It's not such a big issue in regards that the samples, the analytes are stable up to 7 days. Maybe we should go forward to look if they are stable for 40 days, 14, 15 or 20 days, and to find a solution how to get a very nice protocol and to standardize that. Thank you.
Great. Thank you very much, Aleksandra.
Thank you.